So arriving on scene, patients on the ground here, chainsaws are a fair distance away, no branches falling off the tree, no bystanders or dogs. Are you happy to enter?
100%.
Hi there, what's your name? I'm Cassie, this is Ronan.
My name's Claudia.
Claudia, I see you have a massive laceration to your forearm there. Ronan, can you apply direct pressure, please?
I've got that.
Are you able to tell me what happened today?
I was just cutting the tree and I slipped off the ladder.
Cutting the tree and you slipped off the ladder?
Yeah.
That's not good.
No.
Okay, so as the patient is communicating with me, I'm happy to say that the airway and breathing is maintained. Take some saline on this. Ronan, can you put direct pressure, please?
Yep.
3, 2, 1. And circulation obviously has been compromised with this bleed here. I'm just going to apply some direct pressure now. Ronan, are you able to please do a rapid trauma sweep with me, please?
Claudia, I'm just going to do a rapid trauma sweep, okay? I'm just going to feel for some blood. Is that alright with you?
Yeah, it's fine.
Brilliant.
So just applying a first bandage now to put on some direct pressure. And while we're doing this, we can twist the bandage over the site of the wound to put on more, increase the direct pressure.
Ow.
Sore ankle?
Yeah.
Okay.
That one.
So after putting on the first bandage, we can see that the bleeding is still coming out. So I'm going to apply a second bandage now. What did you find from the
So,
trauma
no other
sweep?
bleeding. Looks like we have pulse fracture on that ankle.
Okay. Get onto that soon. So do you have any allergies to anything?
No.
Any medical history?
No.
Taking any medications at the moment?
No.
No? Okay. So the bleeding's still coming out, so I'm going to apply a tourniquet. Could you please prep some methoxy for me, please? 3 mils. Do you know what a tourniquet is? No? This is just going to help with your bleeding. So I'm just going to first place this on. And when we're putting on a tourniquet, we put it at least 10 centimetres proximal to the wound on a single limb bone, hence why I'm putting it on the humerus, not on a joint and not on clothing. And I'm just going to assess your baselines before we put on the tourniquet, so I'm just going to feel for a pulse. The pulse is weakened, but that would be expected due to the direct pressure from the bandage and just cap refill, but delayed 3 seconds.
So we've got 3 milliliters of oxychlorine here.
Yep.
Expires April 2020.
Okay.
So pretty heavy use. Okay.
Yep, this is methoxy, expires April 2020, 3 mils. So have you seen this before?
No.
So you haven't had it in the past 7 days?
No.
Do you have any family history of molecular hypothermia?
No.
Do you have any non-renal or kidney issues?
No.
No, and you're able to obey my command, so I'm happy to give you this. And some side effects this may give you is that it may cause nausea, lightheadedness, or drowsiness. And before I do this, I'm going to do my 5 R's. So the right patient, this is Claudia. Right drug, this is methoxy. Right dose, this is 3 mils. Right time, it is 10:30, and the right route, she will be inhaling it. So just hold this in your good hand, and if you want to increase, get a stronger dose, put your finger on that hole there, and just breathe in and out of it, puff it in and out. Ronan, could you please call for IV backup analgesia?
Certainly. AUT1 to comms.
AUT1, go ahead.
Requesting R51 for IV analgesia.
Roger, copy. 25.
Copy that.
So I'm just going to tighten the Velcro now. And obviously if we're doing this on a real patient, we would tighten it, the Velcro as much as we could. And we would twist the tourniquet at least 2 to 3 times or until the pulse was no longer present. And then we would record the time. So I've now twisted up the tourniquet, so I'm going to reassess the baselines by feeling for a pulse. The pulse is no longer present, and cap refill. Okay, so I'm going to take off the bandages now, just to ensure that the tourniquet has worked. If the bleeding hadn't stopped, then that would be appropriate to use a second tourniquet, or if the first tourniquet were to break for some reason. And with our bleeding, we have 2 types of bleeds. We have arterial and venous. An arterial bleed is more bright red coloured, and it will be squirting in time with the heartbeat, whereas venous bleeds, they were more dark in colour and be oozing out. So I'm just going to clean this with some saline now. Okay, I'm happy with that, and I'm just going to put on some clean gauze just for cleansing this. Are you able to hold that like that? Ronan, can you please take some vitals for me, please? Could you please take heart rate, blood pressure, breast rate. Oscar will take the lungs, cap refill, temperature, and blood glucose levels.
Certainly.
Have you eaten today?
Yeah, I have.
You have. So, and you feel dizzy before you fell?
No.
Okay, I'm just going to still take a BGL just for precautions.
Okay.
And while Ronan does this, I'm going to do a secondary survey on you if that's okay.
Yeah.
So just let me know if you feel any pain at all. Just going to feel the scalp for podginess. Feel the mandible. Down the side of your neck. All good?
Just going to take your blood pressure.
Okay.
for you.
So some C-spine midline neck pain. I'm not going to feel down the arm as obviously it's been compensated.
Just keep your neck nice and still, Claudia, okay?
Just hold your arm here if that's okay. Could you breathe in for me, please? And out. So I was just feeling for bilateral movement of the lungs to ensure the patient has no risk of pneumothorax. No pain? Just going to feel the pelvis now. As the pelvis can have up to 1,000 milliliters of blood loss in it. That's all fine there?
Yeah.
Just on the femurs. Patella movement. And you obviously have a sore ankle, so I'm not going to feel too far down there. So just okay. I'm just going to assess some baselines on your feet here. So are you able to? But before this, I'm just going to take your socks off.
Yeah.
Okay. Just have a good puff of that methoxy for me while I take your sock off. Cool. Awesome. Can you feel this on both feet?
Yeah.
Both even?
Just take
What
your
about
temperature,
this?
Yeah.
Cap refill. Pedal pulse. It's quite normal on both sides. Colour looks good to me and warmth as well. Okay, so I'm just gonna
Claudia, sharp right.
check your patella movement now.
Mhm.
So I'm just gonna support this foot here. Yep, awesome, cool. And just the same with this side. Cool. Just gonna come back and check the pupils. Just look straight up to me, please. Awesome. And with our tourniquet, it's important to check these vitals as the patient may potentially run the risk of going into hypervolemic shock. And this is just when blood cannot be perfused sufficiently enough to tissues, and more specifically the myocardium tissue. So it runs the risk of the tissue becoming ischemic and then infarct, and the patient may potentially go into cardiac arrest and therefore potentially die. So from the secondary survey, I'm happy to give the patient a GCS score of 15, as all motor scores and movement was fine with me.
Alright, so vitals are looking good at the moment.
Yep.
So we've got a temperature of 37 degrees Celsius.
Yep.
Blood pressure of 120/80.
Yep.
Lungs are clear.
Yep.
Can't hear anything abnormal. Got good movement of breath here. No accessory muscle use. We've got a heart rate of 80 beats per minute.
Okay.
We've got a blood glucose of 5.0, so low hypoglycemia.
Yep.
And we've also got a cap refill of 2 seconds.
Okay, awesome. I'm happy with all of that. It is all in the normal range. Rona, could you please come support Claudia's head as she's complaining of C-spine midline. So Claudia, I'm just going to put a C collar on you.
We've got a rest rate of at 10 breaths per minute.
Okay. So to use a C collar, we measure this by using 4 fingers from the mandible to the bottom of the shoulder. And then we can measure this back up like so. So Claudia appears to be a no neck, but just to double check this, we can just measure this up quickly. Cool. So precautions for using a rigid C collar is that it may create pressure sores, can increase ICP, and it can potentially compromise the patient's airway. Indications to use a rigid C-spine collar is if the patient's C-spine cannot be clinically cleared, and if they're obviously complaining of midline neck pain. And when we use a C-spine lanyard, that's if we have no access to a rigid C collar and if the patient's C-spine cannot be clinically cleared. So Claudia, I'm just going to get Ronan to slightly lift your head on my count, and when he does this, I'm just going to pop this collar under you, okay? All right, Ronan. So ready, set, lift.
Just keep your head nice and still, Claudia.
You're doing really good. And
Very
back down. It might be a bit uncomfortable, but it's going to help keep your head and neck nice and still. I'm also just going to place a towel under your neck and head, Claudia.
Yeah.
Just to put you into the sniffer's position to help your airway a little bit.
Mm-hmm.
All right, so on my count, Ronan, 3, 2, lift.
Nice and still, Claudia.
All right, and back down. How does that feel?
It's a little bit uncomfortable, but
Okay, it'll help. How's your pain at the moment?
it's about a 7.
A 7? So just before we move on to that fracture now, I might give you some liquid paracetamol. So Ronan, could you please prep 20 mils of that for me?
Yep.
Which is equivalent to 1 gram.
Yep.
So do you have no liver issues? Have you received paracetamol within the past 4 hours?
No.
And you've had no known paracetamol poisoning before?
No.
And you're not allergic to it? No?
So this is liquid paracetamol, and we're drawing up, it expires April 2020. I'm drawing up 20 milliliters, which is the equivalent of 1 gram of paracetamol, because the patient here is under 80 kgs. Alright, so just check that.
Yep, this is liquid paracetamol, expires April 2020.
Check the dosage.
And this is 20 milliliters.
Brilliant.
So before I give you this, are you okay to have this?
Yeah.
Cool. So I'm going to do my 5 R's again. So the right patient, this is Claudia, right dose, 20 milliliters, right drug, liquid paracetamol, right time, about 10:40, and the right route, Claudia will be orally taking this drug. So this is just going to help with your pain for your fracture as IV anesthesia is still a while away, and the Foxy can wear off within 20 minutes. Okay, so if you just open your mouth, I'm going to put this in nice and slowly. Awesome. And then just when you're ready, give us a nice swallow.
Mhm.
All good? Okay. So Ronan, could you please go get pillow and some tape from the truck for me, please?
Certainly.
Cool, thank you. I'm just going to reassess your distal baselines, Claudia. So Ronan, sorry, was it the right ankle or the left ankle?
So I've got the right ankle.
The right ankle? Cool. So cap refill. It's good on both sides, about 2 to 3 seconds. Just going to feel my pedal pulse on both sides. Awesome. Can you feel this?
Yeah.
And this?
Yeah.
Colour looks good to me. And warmth. Alright, so we're just going to use a pillow splint, Claudia. This will just be more comfortable for you, and it will just create a bit of support and elevate your limb. But before we move your ankle, just give us a good few puffs of that methoxy, just to help with the pain a bit. Awesome. Alright, so Ronan, on my count, could you please lift Claudia's foot?
Yep.
Alright, ready, steady, lift.
Nice job, Claudia.
Yep.
You're doing very well.
Back down.
We're nearly there.
Awesome.
Yeah. We'll just hold it up.
Yep.
And then I'll slide down to each side.
Cool. How's that pain?
Yeah, it's a little bit better.
A little bit better? And one more.
Whereabouts do you want it?
Just at the bottom.
Nice. I'll start holding it and then you wrap.
Awesome.
Nearly done, Claudia.
You're doing really good.
Just keep puffing away that methoxy.
Ronan, could you please go get the scoop stretcher from the truck, please? And how's your pain feeling now after I've put the splint on?
It's better than most.
Is it more comfortable? Okay, that's good. If the patient was complaining of their pain worsening, then we would remove the splint as it is not helping the patient's condition. So I'm just going to reassess your baseline score there. So can you feel this?
Yeah.
Can you feel this?
Yeah.
Can you feel that?
Yeah.
And can you feel this?
Mhm.
Can you give your toes a little wiggle for me? Awesome. Just going to feel for a pedal pulse. That's all good. Nice and strong. Cat refill. Colour looks good to me. And once again, warmth is good.